Reflecting on improving the healthcare sector, opposition leader Michael Pintard says this ought to be a bipartisan effort, considering the poor state of public health facilities across the country. His comments follow a war of words in the House of Assembly this week between Prime Minister Philip Davis and former Prime Minister Dr. Hubert Minnis, who pointed fingers at each other for their ails within the industry. Prime Minister Philip Davis, in wrapping up debate on the nurses and midwives bill this week, ultimately accused the former administration of neglecting the Princess Margaret Hospital.
I recall that I was continually reminded, I'm a doctor, but as a doctor, holding the post of Prime Minister, right, and knowing the state of that hospital, and to do nothing. Nothing was done.
Well, in response, Pintard says this.
It is most unfortunate that the Prime Minister seem to have expressed a degree of surprise at the extent to which the hospital has deteriorated, when in fact he's had more than a year to be carefully briefed while he was in cabinet. He should have seen much of this when he visited the hospital, so none of this should come as a surprise.
He adds that the Prime Minister should have listened to the cries of the workers who have voiced their needs on multiple occasions.
In terms of equipment that's not working or not at all present, in terms of overcrowding, particularly in the emergency room, and that Bahamians, their dignity, our dignity is affected because many times persons are outside in the draft with sometimes life-threatening issues because there's insufficient space and resources for nurses, doctors, and other professionals in the hospital to work properly.
Pintard says the Prime Minister and his cabinet must act with a sense of urgency.
He has to be focused on his job. There are many serious domestic matters, particularly in the health space, where there are a number of wards that are inoperable. Obviously, elective surgeries are delayed, but surgeries that are required, there's a limited amount of operating theaters in order to operate.
He also acknowledges that some of these issues persisted while he was in office.
I'm seeking to make sure we have a balanced analysis of the problem, accepting responsibility where we need to, but employing the government to come to the table so that jointly we are able to work on getting all of the operating theaters up, opening up the children's ward, sourcing the requisite equipment so that persons who need help and can't afford the private doctors are able to get the help they need.
For their part, the Davis administration has made some headway in its attempt to improve the healthcare facilities across the country. Health Minister Dr. Michael Darville has gone on record to state that a site for a new hospital in New Providence has been identified and has pleaded with the public to bear with health officials as they try to address a bed shortage. And Prime Minister Philip Davis last weekend vowed to fix the many issues presented to him in his tour of the Princess Margaret Hospital. No timeline, however, has been set for any of these improvements. Leah Cooper, Eyewitness News.